Hi, I am Dr. A. Santhosh Kumar, practicing as consultant urologist, andrologist, and renal transplant surgeon at Lux Hospital, Gachibowli, Hyderabad. Urinary dribble is nothing but whenever a patient passes urine, involuntary or voluntary, patients want to dribble or he himself voluntarily dribble to complete the micturition cycle. So it's like it can be because of multiple factors like incontinence procedures which can be seen in either male or female. It can be like stress urinary incontinence, urge incontinence, where in urgency, that is when the patient have urinary tract infection, there are chances that patient may have urgency symptoms where he is not able to control his bladder and he needs to pee immediately. How we are going to prevent these dribbling? It's like in children, if you are seeing, it can be in neonatal causes where it is a primary, where patient is dribbling in the urine or doing bedwetting. In these conditions, up to 5 years or even 7 to 8 years, this is normal. But some patients cross around 7 to 8 years, they may need medical treatment to stop the bedwetting. At the same time, coming to the incontinence procedures, there are various causes like incontinence, as I told, like it is in urge incontinence or stress incontinence. Urge incontinence is most commonly caused by urinary tract infections or upper urinary tract infections. These conditions can be treated medically if the patient is not severely sick. At the same time, stress urinary incontinence. There is various grading of stress urinary incontinence where patient may need either medical treatment or surgical treatment. So, if the medical treatment along with the medications, we advise patient to do few exercises like Kegel's exercise. We ask the patient to decrease the caffeinated drinks and we ask the patient to decrease his body weight if he is obese. These preventive factors will definitely help him in decreasing the urinary incontinence. Recurrent blood in the urine, that is most commonly termed as hematuria. So hematuria is a condition where patient passes blood in the urine. Either most commonly it can be a benign condition 70 to 80%, or there are chances, depends on the age factors, it can be a malignant cause. So whenever it is a benign cause, it can be caused by urinary tract infections, or it can be caused by stones located in the genitourinary tract, or it can be secondary to a minor trauma, or it can be other infectious conditions like in bacterial infections or anything like. And other common conditions when the patient is elderly, we need to consider malignancy as a cause in this bleeding. Other malignancy can be because of the any malignancy which is located in the genitourinary tract. Either it can be in the kidney, ureter, bladder, or even in the urethra also. Sometimes prostatic malignancies also can cause hematuria. So whenever a patient has hematuria, the primary criteria will be to differentiate whether it is benign condition or malignant conditions. For that, we usually do initial routine investigation like complete urine examination, ultrasonography of the abdomen and pelvis, and then later we will be doing invasive procedures like contrast CT of the kidney, ureter and bladder to look for any malignant lesions which is causing hematuria. So female urinary incontinence is a condition where the female leaks urine involuntarily. Either it can be very significant where she may leak multiple drops of urine, or it can be not significant where it can be few drops like 1 or 2 drops. So the urinary incontinence of various types like stress urinary incontinence or urinary incontinence. So most of the causes of urinary incontinence where they have pelvic floor weakness. So this can aggravate the condition like post delivery, or if the patient has multiple deliveries in the past, it can be normal vaginal deliveries, or if the patient is malnourished, or if the patient is having chronic conditions like chronic COPD where there is chronic obstructive pulmonary diseases. So these are the conditions which can lead to stress urinary incontinence in the female. There is a condition called urge urinary incontinence where the female has the sensation that she can control the urine, but before her control only she will leak the urine. That is called urge urinary incontinence. So most common cause of urge urinary incontinence is because of the infections. Usually the urinary tract infections are most common in female because of the small length of the urethra compared to that of the males. So whenever a patient has urinary incontinence, we differentiate either it can be stress urinary incontinence, urge urinary incontinence, or mixed urinary incontinence. So most of the mixed urinary incontinence or stress urinary incontinence, they may need surgery, depends on the severity or the grade, because grade 3, that is where the patient voids more than drops of the urine, they may need surgery with small procedures called transvaginal taping or transobturator taping which is done. but around 80 to 90% of the patients with stress urinary incontinence can be managed medically. The simple therapies like Kegel's exercise, which they should practice daily, and they have to take good protein diet, and they can be supplemented with few medication to decrease the urinary incontinence.